Hello, Dr. Ashok. Thank you so much for joining in.
Yes, thank you very much for
All
giving me
right.
a chance to talk here.
Doctor, as you know, we're talking about Strep-A infection today, and not many people are aware about the disease of Strep-A infection. And especially
Okay.
if we talk about the infection and the disease, it's mostly found in children. So, doctor, can you tell
Correct.
me what are the exact symptoms of Strep-A infections according to an expert, according you being a pediatrician, a child specialist, according to you, what symptoms can we see?
Yes. See, Strep-A is not very uncommon in India. Even in India, it is widely available. Well, it is seen everywhere in India also, and it is most commonly seen in pediatric age group. So it is not that is not it is not a thing that it is not seen in India or something like that. It is seen widely in India also, and it is usually the presentation with a sore throat, fever, throat pain. They come with ear infections and many some skin infections also it may present. Okay, most of the time they present with throat pain, ear pain, and fever, headache. These are the common prodromal signs which usually we see in pediatric age group.
All
Yes.
right, okay, doctor. If we talk
Yeah.
about the diagnosis, we see there are many disease or there are many infections or conditions which are not easily diagnosed. Do you think Strep A is
Yes.
one of them?
Yes. Yes. There is no any specific as this is a very short period infection. See, unlike typhoid, it won't. If you give a proper treatment, it may we can cure very shortly. And this is very common. The common presentations are sore throat, sinusitis, ear infection, throat infection. Most of the time, it can be treated with oral antibiotics. So, though there are many test methods, it is not widely done in India because of the cost factor or any other factors. So, most of these infections are easily treated in a OPD basis. There are many tests, rapid antigen test, PCR test, and blood culture, throat cultures can be done, but these tests are not commonly done because until unless they don't respond for a initial antibiotic therapy, then only they go for a blood test or a culture test. Most of these staph infections are easily treated through the oral antibiotic. Most of them, I can say 90-95% can be easily treated in a OPD basis. Until unless they develop a complications, okay, otherwise they can be treated. So most of them they are not treated, so it is not recorded that this example dengue, typhoid, these are the commonly done tests and this can be recorded. It can be shown that this staph infection, it is basically is done by PCR and blood culture, which are little expensive comparatively, so it is not done widely.
All right.
And availability of the doing the kits, example blood culture cannot be done everywhere until unless it is an institution method, and rapid antigen test and PCR cannot be done in all small labs. So usually in the institutions they will do this test. So because of this reason, and because the clinical presentation itself is not very this one easily manageable, most of the time the test is not done.
Doctor, if we talk about the child group, the age group of the child in this
Coming to age group of the child, this can present in at any age, even beginning from the newborns, and most commonly in the adult toddlers age group. When age 1 to age 5 is commonly they present with throat pain, tonsillitis, ear infection. Coming to the in newborn 3 months to 6 months age group, the otitis is a very common. Ear infection is very common with the gas infection, and later it may present with the skin infection and tonsillitis. They are usually in the first few years, example in the first 10 to 12 years, this infection is very quite common. As the age goes, the child immunity also develops, and baby child gets frequent infection of this, so they won't usually present any symptoms later, but it can present in any age group.
In such cases, when when you're getting any symptoms like fever or vomiting, so parents get very they panic a lot in such situations. So what immediate treatment can be given to the patient or the child?
See, most of the time it is we should differentiate whether it is a bacterial infection or a viral infection. In the bacterial infection, example in a staphylococcal infection, child will be little more sicker compared to the viral infections. They may have a severe throat pain. They will have follicular tonsillitis. You see the throat is very red and congested. Child will have a severe pain. Child is having a otitis media, ear infection, rashes, high grade fever. These are the cases where you should always suspect about bacterial infection. Okay, where in the viral infection, the child will be playful. In between the fever, child is comfortable, not very much symptomatic. There are no clinical signs. In that situations, it is better to start an antibiotic when the child is sick, so that in the initial stage only it can be managed. See, regarding coming to the treatment part, so we have to differentiate whether this is a bacterial infection or a viral infection. Most of the time, Streptococcal infection, they present like a viral infection. Example, fever, sore throat, like that. But in a bacterial infection, the child will be little more comparatively sicker. Example, baby child may have a high grade fever, throat pain, severe throat pain, follicular tonsillitis. Sometimes they may present with ear infection. So, and the child is not eating well, high grade fever. These are the common presentations in staph infection. Compared to viral infection, where the child will be mild fever, mild sore throat, cold cough usually, and in between the fever, child will be comfortable. So when the child is sick, it is better to start it with an antibiotic. There are many antibiotics which can be managed this bacteria. Initially, it is doctor has to differentiate between this is he has to suspect clinically. If required, he has to go through some investigations and start an antibiotic.
All right, doctor, talking about the oral, you're talking about antibiotics. So, what antibiotic is suitable?
See, streptococcal has a sensitive to the wide range of antibiotic. Okay, coming to penicillin, cephalosporin, amoxicillin, cloxicillin, amoxiclav. There are many antibiotics which are working for this bacteria. So easily this can be treated with a oral medication. Most of the time it is oral medication, until unless child get more sicker when the child present to the hospital with a later stage where there are many complications, then you may require IV antibiotics.
All right, doctor, thank you so much for clearing confusion about Strep-A infection. Thank you so much for joining in. Thank you.
Thank you very much.